The Hindu Hospital for Affordable Healthcare, a cost-effective and high-quality healthcare system, has been out of reach for a majority of the Indian middle class. A significant number of this group in a city like Madras is willing to spend a reasonable sum of money on health. While primary health care provided by physician is also in good measure, tertiary health care is offered by the emerging corporate specialty hospitals, which have responded well to community needs. However, with their huge investment on equipment and high interest rate for financing loan, the tertiary care center are expensive for the average citizen. Hence, the middle class feels the acute lack of secondary care provided by community-based hospital to treat the illness which need hospitalization at affordable cost. It is to target this class that the Sundaram Medical Foundation, a non-profit trust established by the Sundaram Finance Group of Company, is opening a community-based hospital in Annanagar, an area with high density of ever increasing middle and lower middle income group families. The SMF as a concept began in 1990 when it was registered as a trust. The site of about 11 grounds was acquired later. The six-story, 105-bed hospital is nearing completion and outpatient service is set to open on September 2. The other facilities will be open for the public by September end, according to D.S. Rangarajan, Managing Trustee, SMF. The trust board members are from the Sundaram Corporate Group. The philosophy behind the SMF hospital, he explained, is to fill up the lacuna in secondary healthcare, an area bypassed in the high-tech super specialty system. The foundation aims at providing community-based hospital care at an affordable cost with strictly audited quality of service. The emphasis will be on preventive strategies to educate people on minimizing hospital utilization. Donations from group companies. The entire project cost of about rupees 6 crores has been met by corporate donation or soft loans to the trust from the group companies. This will mean no interest burden or shareholders demand for profit. As in corporate venture, both of which can hike healthcare cost for the hospital. A core group of trained full-time specialists will run the hospital, helped by motivated healthcare professionals, paramedical and administrative staff, and a select panel of consultants. The center will start with 65 beds and offer all treatment in all major specialties, diagnostic and laboratory service beside a 24-hour emergency care unit. The hospital has 3 operation theaters. Room service vary from 4-5 bed general ward to deluxe single rooms. A full-fledged auditorium and an ambulance service will also be available. The tariffs for medical and diagnostic services will be charged according to a schedule depending upon the room service opted for. But the rate will remain affordable, says Dr. Arjun Rajagopalan, Chief of Medical Staff. We have consciously stayed away from high-tech care because they are good specialists to do it elsewhere in Madras. Of course, we have gone in for the needed modern technology for diagnostic, emergency care, and intensive care to ensure good quality service to the 2.5 odd population in and around Annanagar, says Dr. Arjun Rajagopalan. Dr. Rangarajan says the hospital believes that healthcare cost can be minimized only by community education and screening to pick up diseases early. In this direction, the hospital, even from the being started, interacting with the local people by asking for suggestion, collecting health profiles, and conducting health camps. One such camp is to be conducted in the last week of this month. Welcomed by people. The initiative has been welcomed by the people as it meets the need for a full-fledged hospital in the sprawling Annanagar and nearby areas like Mugapet, Tirumangalam and Naduvangarai. Mr. K. Aludiyapillai, Member Secretary, State Council for Higher Education and President, Annanagar Residents Welfare Association, who has been interacting with the hospital authorities ever since the idea was mooted, says he is looking forward to the affordable healthcare facility which caters to the entire family. Ms. Menaka Raghupati, President, Annanagar Ladies Club, comments the project as giving priority to women healthcare and welcomes the idea of the hospital running transport service for the benefit of patients. The president of ExNoRa Club of Annanagar, Mr. R. Gopalaswamy, hopes that when the facilities promised or provided for hospital can be rendered the much needed relief to people as healthcare and diagnostic services as turning expensive. Many residents particularly welcomed the hospital's initiative to invite suggestion and the participation of the local community has also decision to conduct regular health checks. The managing trustee hopes the hospital would become a benchmark for efficient and affordable healthcare. Once this level is reached, the hospital hopes to become a center to train postgraduates in community-based health. Plan to open peripheral centers in rural industrial belt are on this anvil. The days of inefficient subsidized healthcare are over and society demand the best and efficiently tailored healthcare delivery system. We hope to provide this, Dr. Rangarajan says.